For me, Colette Whelan is a friend. She's a former co-worker. She's a community member who's doing a lot of work both for the community of Bend, the greater Central Oregon area, and internationally.
Not only does she have this incredible enthusiasm for volunteering overseas, but she doesn't lose her enthusiasm at home. She's very active in this community.
What makes Colette tick is the compassion she has for running into the disaster and taking care of the people.
I think Colette exhibits that ability of organization and prioritization, of being able to triage effectively, as well as empathy. She's able to empathize and help people regardless of their status.
She has one of those special abilities that when you go into a disaster that's overwhelming, you can hardly handle it. You know, you have the death, you have all this, you have that sort of stuff. But Colette is able to detach herself yet still have that kindness and that lovingness towards the patients, which you don't see very often in too many people.
Colette has volunteered in a lot of different places in the world. She's made several trips to Haiti. She went to Pakistan after the earthquake there. She responded to the tsunami in Banda Aceh, Indonesia, and she's also volunteered in Vietnam.
Some of the hardships I think that Colette encounters when she goes on these post-natural disaster or post-disease missions is the numbers of people, and where the volume of patients far outmatch the resources available. The conditions that they're in are very primitive. Generally, clean water is an issue, even their own safety as far as whether the scene is completely stabilized. And then the fact that there is the potential for their own health to be impaired.
Disaster response is a really creative process. You have to be able to create order out of chaos, and you change your priorities all the time to match the situation as it changes, and that's Colette's specialty.
One of Colette's goals is to go to third world countries and start education and teaching about how to respond to events, how to respond to health matters, so that we're not going down there in a crisis mode at all times.
We have a strong local need in our community. People need help here also, and Project Connect is a way that medical professionals can volunteer their services to people locally in need.
She's been the coordinator for the volunteers, the personnel that work with Project Connect, which is a service to the homeless here in Central Oregon. And the organization, the numbers of people involved really show that volunteerism is alive and well here in Central Oregon.
It takes a person to go deep down, a selfless person. It takes somebody who has an absolute desire to make sure that that person who's been homeless for 10 years is going to get some assistance. So we all don't have that. Colette does. Colette has what it takes.
I think that reaction from anyone who knows Colette of, I would do anything for Colette, comes from the fact that they know that she would do anything for them.
What impresses me most about Colette is that Colette just takes care of what needs to be taken care of. She doesn't really ask, she goes in, she's a hell of an assessor. She can look at the situation, she can know what needs to be done, and she does it.
What I admire most about Colette is that she never walks away from a challenge. She just marches right into it.
The thing that impresses me the most about Colette, having known her for over a decade, is that she's what I call a seeker. She's looking for ways to improve herself, to get more skills, to be more efficient, to be able to bring a broader level of service and care to a broader spectrum of people.